Welcome to Health System CIO's interview with Mari Savickis, VP of Public Policy with CHIME. I'm Anthony Guerra, founder and editor-in-chief. Mari, thanks for joining me.
Thank you for having me again.
Awesome. Looking forward to a nice, fun chat. I think everybody knows about CHIME, so I don't think you need to explain the organization, but a little bit about your role. I know you have two ladies working with you very closely, so tell us a little bit about how you guys are covering policy and how you split it up over there.
Sure. We are a small but mighty team of three. I lead the department, and I have Chelsea Arnone, who is our Director of Federal Affairs, and Cassie Ballard, who is our Director of Congressional. So one does the administration, one does Congress. I somehow cover both, and we try to punch above our weight. So we're the voice of our members in Washington.
Very good. So, I don't know what this time of year, early December, means for policy stuff, if things start to quiet down or whatnot, but I want to start pretty open-ended. Maybe give us a couple of the main things that you're working on for your members, a couple of the main issues that you're trying to drive change in or influence.
Yeah, it's obviously I'd like to say like the furniture's on the ceiling, or every 4 years we have a change in administration. So for us, it's getting ready for a new administration and a change in party. So it's a lot of tracking things that, what that change could look like from a holistic standpoint, right? So the policies that are under the Biden administration are not going to oftentimes be the same policies that are going to be in Trump 2.0. So it's a lot of that monitoring the landscape, which is like what we would call like shifting underneath us. In terms of more granular things that we're watching, we have, the big thing on the horizon is the funding, right? December 20th, for those who are not here living here in the bubble, that's when the government funding runs out. So we need to fund the government. That's job number one here. And with that, a lot of policies are tied to that, including telehealth extension, which some of your listeners may recall was extended for 2 years by Congress, and the deadline for that to expire is December 31st. However, it'll be wrapped up into what we call the continuing resolution, which again, the funding ends the 20th. So we're looking for that. The R's and the D's are going back and forth around, they're negotiating what that's going to look like and whether it's going to be maybe a 2-year extension versus a 3-year. For a short while, for about like a week or two, we were thinking it was maybe going to be like really, it could be less than that, but it looks like it's going to be, 2 or 3 years. So that will be great. The CR right now looks like it's going to take us into March. So that once the new administration comes in and they have their feet fully wet and, the Republicans have control of both chambers of Congress and the White House, then they will start really cementing their financial priorities. So that's where we are with, I would say, with telehealth. Cybersecurity is always a hot topic here. I mean, a day doesn't go by where we're not talking about cyber. That's our top priority, which I know we'll talk about AI in a second, but cyber is just so important. And as of late, we're looking at a Senate help bill, which is bipartisan, and that one is something that we've had some input into. It's the Healthcare Cybersecurity and Resiliency Act of 2024. It doesn't exactly roll off the tongue, but it is important. Do any bills? That one, I don't know. Does that one have an acronym yet? Everything has an acronym in DC. I haven't seen the acronym for that one. But that one has possible grants and standards and coordination pieces, things that we've all supported. So we like that. And we're looking at that. And that could, that will probably have to get reintroduced in the next Congress, but it's putting a mark in the ground. So that's something we're paying attention to. There's even a rural component in there. And rural is getting a lot of that's it's having its day in the sun. And when we say rural, though, my team and I, we really say rural and hard to reach and underserved. There's a lot of providers who may not necessarily be rural, but are underserved, like the LT-PAC community, who never got funding for EHRs. But nonetheless, rural is really very much in the spotlight of lawmakers and other stakeholders. So we're watching that and just trying to make sure, because they're like the proverbial 20%, you're trying to pull them forward. You don't want to be cyber attacked on the weakest link. They're under resourced. They can't afford things. So we're doing anything in our power to shore up those rural and underserved providers, and pretty much everything that comes out of this shop, you're going to see that in our letters. Like, please help the underserved, please help the rural folks, please find more funding, let's use more carrots and fewer sticks, so on and so forth. So I don't think you will see a letter out of my shop that doesn't include that information. So cyber, that's cyber. AI. So, I mean, we could go down so many holes with either any of these topics. Um, with the AI stuff, I think this has been widely covered even in the national media, is Trump wants to take a different tact. So I think you're hearing a lot about fewer mandates. That's going to apply across the board. The AI stuff, he's threatened to like rip up the Biden AI executive order, which is really non-binding. Presidents like to use these to kind of set their agenda. So he will issue his own AI order, executive order, and I think you can expect to see him retain pieces of what Biden had, pieces that like would overlap, like say on innovation. But there right now, anything coming out of this administration on AI is, pretty much could be destined to be, reviewed and clawed back, so on and so forth. I know that HHS has said that they're planning on releasing an HHS AI strategy, and that is coming in January, but it's pretty much, it's going to start collecting dust soon because the new administration is going to come in and they're again things like Congressional Review Act, which is really more for rules. And they can start clawing things back. And we've seen this used before, though we were looking at some of the data, and the CRA, Congressional Review Act, it's a fancy DC term of, that just says basically, hey, listen, we can pull back rules that we don't like if they, fall in a certain time period and meet certain criteria. And so that's going to be a tool in Trump's arsenal that he can use to pull things back. And I think it goes back to August 1st. Like any rules that were finalized as of August 1st are really, and moving forward, it gets a little bit more complicated to explain, but it can push into 2025. And so those things will be on the chopping block. Anything that's controversial that creates like unfunded mandates, we'll be looking at all of these things. I know you've heard of the DOJA, the Government Efficiency, Department of Government Efficiency, the unofficial department. And so we're going to be looking at, again, unfunded mandates, things that stifle innovation, things that are like regulatory burdensome. These are all things that I think this administration, or costs a lot of money, are definitely going to be on the table for review. So AI will be wrapped into this. They're going to want to let innovation flourish, right? They're going to, like HGI2 is rattling around. That thing will probably get clawed back. That's an ONC or ASTP rule. So there's a lot of ways that Trump can come in and put his mark in the sand. And, I think another thing too for listeners to pay attention to is that we may think something is like critically important, but on day one, for example, if they want to deal with immigration, that is not my swim lane. So there's a lot of things sometimes that take up a lot of oxygen and we have to wait our turn. But I expect them to move fast. Let's see what else. Let me just take a breath there, Anthony, and just see. I could just
Sure.
ramble on and on, but I won't.
All right, I'll ask a few follow-ups. So telehealth, the biggest concern would have been that things expire. You're saying that's not really a concern. You're looking at definitely an extension of at least a couple years. So we
I
don't have to
hope
worry
so. I
about
mean,
that.
that's what's on the table right now, and they're everything. So the other thing too is that you may have heard of this term pay fors. There's a lot of DC lingo.
Mm-hmm.
You have to pay for the things you want to buy, right? So if you want to buy, telehealth is not free. It's a cost to the federal government. And so there's, I think, $22 billion in savings if they claw back the nursing home staffing rule, but the Democrats don't like that. So I'm not sure how they're going to fund this. This is all like getting, discussed like right now as we speak. This is being hammered out. So they need to figure out ways to pay for what they want to spend. So it's not clear to me how long it's going to be. We were worried it was going to be really short because there was some chatter on that, but I think, yeah, I think it's going to be a few years.
All right.
Yay! That's good for
Yeah,
us.
so we don't have to put that at the top of the worry list. Around cyber, it seems to me like, you mentioned Rural's Day in the Sun. That's what it feels like to me. That, really not too much going on the cyber front other than the trying to get support for rural organizations or, as you mentioned, underserved. There's still the Eric Deckers out there with the best practices and Greg Garcia and then those folks putting together the hiccup and these kind of things, which are useful and helpful. There was, I forget that really long acronym of stuff that they were coming out with. They were going to be voluntary and then mandatory and some basic stuff and things. I haven't heard too much about that lately. I assume it's on track, but nothing about that was sort of scary or frightening. It was all sort of things that people would be doing. And um, so is that, I don't see anything else big on the cyber
Yeah, so
front.
those are the CPGs, the
Right, right.
cybersecurity performance goals. Sorry, I didn't mention that. So actually, that would be an, quasi-funded mandate if it were to go through. I won't get too in the weeds on this, but I'll just say this. There are two rules in play that have not yet been released from this White House. There's the HIPAA security rule, right, which would basically rip up the existing HIPAA security rule and create what we're anticipating would be mandates like CPGs. That's what we've been widely anticipating. And then there's this other rule that I think it's lesser known, but it has to do with hospital resiliency that's out of CMS, which would really be cyber. It would contain cyber. It's expected to contain cyber mandates for hospitals. However, that little Chevron decision, remember
Hmm.
that little Supreme Court decision this summer? But your listeners can Google it if they haven't heard about that. That I think threw a monkey wrench into things. And so it made the administration have to stop for a moment and make sure that they were kind of like Chevron proofing their rules. And I think in doing so, it slowed things down. And so now it's those rules are at the White House, but at this point, it's your guess is as good as mine is if they'll get released.
Hmm.
There is actually a call this afternoon with ASPR. I don't think it's open to the media. I could be wrong, but who knows what they'll announce that afternoon. But I mean, we'll just look and see if that gets announced. But even if it did, even if one of them did get released or both did, that goes back to the CRA, the Congressional Review Act, the clawback mechanism. And so I think that anything that's creating a mandate is going to receive a ton of scrutiny.
Yeah, it's so interesting. I mean, the climate is completely changing between, and there's a number of these things you mentioned that are coming together. The Chevron decision is making it should be making regulatory folks think twice about overreaching.
Mhm.
Um, the Musk and Vivek, what is it? Doge? Is that how you pronounce it?
Doja, I think I always
Doja?
get the way
Yeah,
you pronounce it
I know it's
correctly
DO.
wrong.
Yeah, I
Doja.
know. I don't know why they had to make it something sort of complicated to pronounce, but
I know. I
um,
don't know, Anthony.
you got Chevron, you have that thing, and then you have this clawback stuff. It's certainly an environment that is not, hey, let's get a bunch of unfunded mandates out there and regulatory stuff. It's completely the opposite. So that's kind of interesting.
Yeah, I think it's a good time to be an attorney. I'm not an attorney. I just like pretend to play one, but it's a good time to be an attorney so you can basically, prognosticate and try to read the tea leaves by understanding the legal morass that will be like they're going to undo, like AI executive orders, which is totally within Trump's right to do that. He could use again the Congressional Review Act, which he 20 times out of the past few administrations he used it. I think it was like 16 times. So
Mhm.
prepare for that him to use that. I mean, there's going to be all kinds of things that are going to walk back.
I don't
And
even
then
what
lawmakers were getting involved too, so they're getting like all spun up.
right, right. So this AI executive order, I mean, how meaningful is something like that in terms of a CIO's day-to-day work? Are they like, oh my God, now I have to do A, B, and C? No, I don't think so, right?
Yeah, I mean, well, so again, like there was a lot of work that was actually done under the Biden administration's AI executive order, which was extremely lengthy and detailed. And I believe, hat toss to Chelsea on this one. It's tied to this the HHS AI strategy that I mentioned that's going to come out in January. That's probably going to just go right into like the dustbin because they're going to just, they're just going to put their stamp of approval on this. And so that's what they are expected to do. Where was I going with this? That's
We
it's
were
just
talking, go ahead.
yeah, it's just fraught with change. And so, I mean, Trump has already made these declarations. He's like, I'm throwing this away and I'm going to have my own AI order. He actually had his own AI order during Trump 1.0, just to be clear,
Mhm.
too. Like, maybe people may have forgotten about that. So this wouldn't be the first AI order. But he'll keep what's reasonable in it. I mean, it's, just like Biden kept some cyber stuff. I mean, there are places they actually agree. I mean, one thing that's crazy, this is a little bit of a sidebar, but Salt Typhoon, is that on your radar, Anthony?
Is what on my radar? Say it again.
Salt Typhoon, you should go look that up. That's
Oh,
has nothing to do, well, I mean, it's tangential to healthcare, but it's a cyber incident related to the telecoms, and that is just so incredibly scary. Let me give a hat toss to Cassie, my other colleague. She mentioned this is always such an interesting place to just poke around in. The NDAA, the National Defense Reauthorization Act. This is a treasure trove of information. It's literally like a kitchen sink for defense, but they always have technology stuff in it. And so she pointed out to me there's actually a provision in the bill right now that has to do with like a study to Congress around cyber foreign threats to cybersecurity in the American infrastructure. So if that passes, then we're one of the critical infrastructures. So Salt Typhoon is just crazy unto itself.
I'm gonna look it up and I'm
Look it
gonna
up. It's
gonna read about
basically,
it.
yeah, basically every single carrier in America has been infiltrated. So not
Oh,
good.
well, that's good
Yeah,
news.
yeah, yeah. I'm full of good news today.
Why not? Why not? Okay, so we have that. We talked about the rural stuff. I mean, the AI stuff to me, as far as our, readers and your members, it's just a lot of privacy stuff in there. I mean, that's a lot of the biggest
Mhm.
concerns, right? Is that we have a sandbox that is protected. So we can't put it into the big public sandbox because we have PHI. So we don't want our clinicians going in and, trying to
Mhm.
get, use AI to get their studies done or their questions answered and putting in a bunch of data that could sort of be leaked out on the other end somewhere. So there's a lot of privacy stuff around AI. And then the other thing with AI, for the people that follow what we do is the concern, the reluctance, or being very cautious about using it for any sort of independent clinical recommendations, right? I mean, I
Mhm.
gave this to Mari because the AI told me to, and hey, it didn't work out, right? So that's
Yeah. So on those two issues of privacy and a nexus between privacy and AI. So for the past few years, we've seen a flurry of activity at the state level on privacy bills and laws, right? We're not going to, I think, all indications point to us not having or getting a national privacy law anytime soon. They couldn't even get the children's one over the finish line. So I don't think that that's going to happen anytime soon. It kind of died on the vine this summer. Um, so that is out there rattling around. And so that leaves like a vacancy, a vacuum. And so the states are trying to fill that in at the same time. And that was like that momentum started a few years ago. Then you have the AI stuff, which makes privacy even more scary on some level, right? Because people are playing with tools and, at least in healthcare, protected health information or sensitive healthcare could be leached out. We don't have a national AI law either. And so we're beginning to see state activity on that level too. So any CIOs and CISOs listening, go check out your state activity because that's absolutely going to gain momentum.
and that makes things really tough. And I've spoken to people about this when you're a multi-state entity,
Hmm.
and you have people coming from across the country. Maybe you're
Yeah.
destination healthcare provider where people travel to you, and you're in that difficult position of having to figure out if you need to comply with, could be 10, 15, 20 state specific laws. So it
Hmm.
gets a little hairy there. And we talked about this last time, how that national law, which would supersede the individual state laws, would be welcome to many multi-state providers, but it didn't work
Yeah.
out. So.
It would be great to have that clear delineation and simplicity, I guess, more simplicity, but that hasn't happened. I don't think that the political climate is right now for that to occur.
What about interoperability, data blocking, anything big
Yeah,
on anything on
so
that
you
front?
get, yeah, oh, data blocking. That's such a fun term. Um, I again, I'm going to prognosticate a little if I like go consult my crystal ball. If you're looking at like say a TEFCA mandate, possibly like there've been chitter chatter about that, and it's a mandate, right? So we're going into like a anti-mandate era where they don't want to put more regulations and
Hmm.
handcuffs on people. They just like tie them to a certain way of doing things. They'd rather just see like the industry work it out themselves. So I don't think you're going to see that. I don't know how much they're going to, how much they're going to fund ONC. So ONC has to, it's ONC and OIG, right? They need to police this environment. And so we haven't figured out funding for FY25. I'd be watching for, it's now ASTP, right? So we need to look at how many resources does the government have to go after information blockers, even though these policies are on the books. But I don't think you're going to see, say a TEFCA mandate come out of CMS, like at least initially, right? Like
Hmm.
maybe something in like the promoting interoperability that, that was rattling around. So I don't know. I think that's going to be definitely like up for debate.
All right, yeah, the patient matching is not going anywhere, right? National Patient
Well,
Identifier.
no, so thankfully we got, we actually made some progress this year, believe it or not, Anthony. Match It
Oh,
Act. Go look up at the Match It Act. We have 13 co-sponsors and it's patient matching standards, which, I think your listeners know that there's no patient identification standard in this country because Congress has prohibited funding for HHS to do any even like it's not even a patient ID number, it's just like the standard. So instead, we went after patient matching standards, which is what the Match It Act does. And that actually seems to have some momentum. However, we're at the end of a Congress, so they're going to need to take that up again and reintroduce it. But that I think is something to watch for. So contact me if you want more information on the Match It Act or you want some talkers to go learn a little bit more about it or talk to your congressional representative. We're here to help you.
anything else that your members or sort of want you to advocate for that we haven't touched on that's sort of important to them? I mean, we talked about interoperability. There's, standards are a big issue there. They'd love for you to be able to export a Cerner record and import it into Epic, but I don't think we're there. And, there's all kinds of standards. I don't know. I mean, anything else your members are clamoring for that we didn't touch
Well,
on?
we're all about standards every day, all day long. It just makes life so much easier. I mean, I think the name of the game going into 2025 is going to be the door. When the door opens, you run through it. And in this case, the door has been opened on the notion of like reducing regulatory burden and
Hmm.
mandates. And so we're going to be, maybe this is a little bit teaser. Hopefully, Cassie and Chelsea don't want to throttle me, but look for, a survey from us on helping us identify and prioritize where they think the burdens are. And so we're going to be digging into that a little bit deeper and try to understand because, and if you have specific, like rules or policy that really just is, gives you heartburn, then those are the things we're going to want to pay attention to. But we need to take, lift off some of these administrative burdens, things that also aren't like a big bang for the buck like ADT, that was admission, discharge, and transfer. I'm just picking up one, right? I mean, that's still a requirement, but I don't think I've ever heard anyone get in trouble for ADT. And I've heard from members that, a lot of times the information has to go to like the primary care, but it's not always that easy to do that. And then sometimes they're like, why are you saying this to me? So there's just some things that I think that we can navigate the regulatory morass and make things a little bit cleaner and that in turn would free up resources. That's one thing. And the other thing is using AI responsibly so that you can improve efficiencies, maybe even on the back end. Most of our members are not using AI still for clinical, but if you can use AI in a manner to do back end operations that you can squeeze out some savings, then you can take that savings and reinvest it into whatever, wherever you need that, whether it's for some cyber tools or to build up your workforce. Those are two areas I think that are ripe for more attention.
Yeah, you made a great point, and the idea that the new administration is going to be sort of anti-regulation and wanted to cut waste and cut red tape. And there's a lot of that your members and our readers have to deal with, right? Because
Yeah.
that's one of the things they talk about is there's so many things that you have to document to be compliant, and there's so many places that different metrics, quality metrics, right? You have to be sent here and there and everywhere.
Hmm.
Huge burden, and it contributes to burnout because it contributes to all the things that you have to make the EHR do that whoever's interacting with it needs to document. So why not, sort of as you said, swim with the tide? The tide is let's get rid of some of this stuff. Certainly, a lot of folks want some of this stuff gone. So it sounds like you're saying to your members, let's talk.
Hmm.
Let us know what are the really difficult and you feel unnecessary regulatory burdens, because we can package this up, go up to Capitol Hill, and
Yeah,
we may find a very receptive audience.
that's exactly right. You nailed it. I couldn't have said it better. Send me all your ideas.
That's great. I'm proud of myself. I'm
You could
proud.
you could be a lobbyist.
That's great. I'm in. I'm in. That's awesome, Mari. I think that's about all I was looking for today. Is there anything else you want to add? Any call to action for your members before I let you go today?
I sign up for our debrief. That's like the hard hitting newsletter, that easy newsletter every Monday. You will find us at policy@chimecentral.org, and it's free for anyone to sign up. And it gives you hard hitting information that's timely that you can use with your boss. It makes you sound super smart, know what you're doing. So, yeah, sign up for our newsletter.
Awesome. Well, exciting times, new administration, end of year. Very cool. Lots of stuff to follow. So thank you so much for taking a few minutes today.
Yeah, thanks for having me.
All right.